Lung cancer is the leading cause of cancer-related deaths. Non-small cell lung cancer, or NSCLC, accounts for 80 to 85% of lung cancers. Normal signaling from epidermal growth factor receptor, or EGFR, promotes cell proliferation and survival. Mutations that can arise in the kinase domain have been identified as critical drivers of some NSCLC tumors, resulting in tumor growth and metastasis. Two mutations account for approximately 85% of all EGFR mutations. These are exon 19 deletions and the exon 21 mutation L858R. These two mutations also make tumors sensitive to treatment with EGFR tyrosine kinase inhibitors, or EGFR TKIs. Even so, patients with NSCLC inevitably experience disease progression within 9 to 13 months when treated with earlier generation EGFR TKIs. TAGRISSO, or osimertinib, is a third-generation irreversible EGFR TKI with a distinct chemical structure. TAGRISSO is designed to inhibit both EGFR sensitizing and EGFR resistance mutations. TAGRISSO irreversibly and selectively inhibits the two most common EGFR sensitizing mutations, exon 19 deletion and L858R. TAGRISSO also inhibits EGFR T790M, a common resistance mutation. At the same time, TAGRISSO has lower activity against wild-type EGFR. TAGRISSO crossed the blood-brain barrier in preclinical models. In a clinical study, TAGRISSO crossed the blood-brain barrier in 8 healthy humans. TAGRISSO osimertinib is indicated for the first-line treatment of patients with metastatic non-small cell lung cancer, NSCLC, whose tumors have epidermal growth factor receptor, EGFR, exon 19 deletions, or exon 21, L858R mutations, as detected by an FDA-approved test.
Indication: TAGRISSO is indicated for the first-line treatment of patients with metastatic non-small cell lung cancer, NSCLC, whose tumors have epidermal growth factor receptor, EGFR, exon 19 deletions, or exon 21 L858R mutations, as detected by an FDA-approved test. Important safety information for TAGRISSO. Osimertinib. There are no contraindications for TAGRISSO. Interstitial lung disease, ILD, or pneumonitis occurred in 3.9% of the 1,142 TAGRISSO-treated patients. 0.4% of cases were fatal. Withhold TAGRISSO and promptly investigate for ILD in patients who present with worsening of respiratory symptoms which may be indicative of ILD, for example, dyspnea, cough, and fever. Permanently discontinue TAGRISSO if ILD is confirmed. Heart rate-corrected QT/QTc interval prolongation occurred in TAGRISSO-treated patients. Of the 1,142 TAGRISSO-treated patients in clinical trials, 0.9% were found to have a QTc greater than 500 milliseconds, and 3.6% of patients had an increase from baseline QTc greater than 60 milliseconds. No QTc-related arrhythmias were reported. Conduct periodic monitoring with ECGs and electrolytes in patients with congenital long QTc syndrome, congestive heart failure, electrolyte abnormalities, or those who are taking medications known to prolong the QTc interval. Permanently discontinue TAGRISSO in patients who develop QTc interval prolongation with signs or symptoms of life-threatening arrhythmia. Cardiomyopathy occurred in 2.6% of the 1,142 TAGRISSO-treated patients. 0.1% of cardiomyopathy cases were fatal. A decline in left ventricular ejection fraction, LVEF, greater than or equal to 10% from baseline and to less than 50% LVEF, occurred in 3.9% of 908 patients who had baseline and at least one follow-up LVEF assessment. Conduct cardiac monitoring, including assessment of LVEF at baseline and during treatment in patients with cardiac risk factors. Assess LVEF in patients who develop relevant cardiac signs or symptoms during treatment. For symptomatic congestive heart failure, permanently discontinue TAGRISSO. Keratitis was reported in 0.7% of 1,142 patients treated with TAGRISSO in clinical trials. Promptly refer patients with signs and symptoms suggestive of keratitis, such as eye inflammation, lacrimation, light sensitivity, blurred vision, eye pain, and/or red eye, to an ophthalmologist. Post-marketing cases consistent with Stevens-Johnson syndrome, SJS, and erythema multiforme major, EMM, have been reported in patients receiving TAGRISSO. Withhold TAGRISSO if SJS or EMM is suspected and permanently discontinue if confirmed. Verify pregnancy status of females of reproductive potential prior to initiating TAGRISSO. Advise pregnant women of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with TAGRISSO and for 6 weeks after the final dose. Advise males with female partners of reproductive potential to use effective contraception for 4 months after the final dose. Most common adverse reactions, greater than or equal to 20%, were diarrhea, rash, dry skin, nail toxicity, stomatitis, fatigue, and decreased appetite. Please see complete prescribing information, including patient information, available at TAGRISSOHCP.com.